We're going to jump right into it. Good Friday, so whether you're celebrating Passover or Easter or whatever you're celebrating, maybe nothing, then, you know, happy Easter, happy Passover. We're going to do something a little different today. We've used to call this section mentions and tips, and we're going to change that moving forward. And we're going to call it Balance University's Prescriptions, right? We're going to call it BU Prescriptions. And we're going to make it a pointed inference, right? We're going to make pointed statements. I want to give you bullet points. Instead of standing up here and talking for 10 minutes, we're going to just maybe condense that and put a lot of information in to about 3 to 5 minutes is going to be our aim. So this morning on our first edition of Balance University Prescriptions, we're going to be talking about falls. And we're going to be talking about, of course, surprise. We're going to talk about falls in the home. And what can you do to fall-proof your home? Lists are great. Lists are fine. I haven't been the most excited or enthusiastic about lists because a lot of times what people do with lists they get from their therapist, lists they get from their doctor, they'll take their list home and they just throw it on the kitchen counter and that's where it stays, or the dinner table, or the treadmill, and that's where it stays. But what we want to do is I want to try to give you some things that you can put into action, right? So like a call to action is what we're doing. By 2030, the CDC projects 49 million older adults will fall each year, resulting in 12 million injuries, $100 billion in health-related spending. Some of the statistics that were out, according to the National Council on Aging, was talking in 2016 how we had over $50 billion that were attributed to fall-related injuries, and Medicare and Medicaid bore 2/3 of those costs. With 10,000 Americans turning 65 every day, our cost is going to continue to rise. So we must have this call to action and put into use what we're learning. And what we need to do at the doctor's office is start prescribing balanced classes, things that are going to help us to prevent falls, because falls are not a natural part of aging. A new study suggests that these sort of advice hasn't proved to be very effective. Nearly 3 times more adults aged 75 and older died from falls in 2016 than in 2000. Let me read that again. Nearly 3 times more adults aged 75 and older died from falls in 2016 than in 2000. What are we talking about? What advice are we talking about? Older adults who are worried about falling typically receive general advice. Take an exercise class. Get your vision checked. Stop taking medications for sleep. Install grab bars. These are all great pieces of advice. These are all things you'll find on your list, but they will not prevent you from falling as much as balance-specific exercises like what we're doing here. All right? So, all references and sources are available at mybalanceuniversity.com. Go to the bottom, look at references and sources. My class notes are posted. You can download them, you can read them, because I do not read everything I have in class. Where do most falls occur for our seniors? According to the CDC and extensive data on injuries and deaths from falls in older people, it does not track additional information, but what it's telling us is that a Cornell physician responsible for training other doctors studied this, and what they found was 60% of falls happen inside the home, 10% in a healthcare center such as a hospital, clinic, nursing home, rehabilitation center. So that accounts for 70% of falls inside the home or inside a nursing home or a CCRC, a continuing care retirement community. Some other places, stairways. If you have stairways, you want to be mindful of every step. Bathrooms and powder rooms. Now these can be dangerous. In fact, Mr. Wolf fell victim, and how many of you have tried to get up from the toilet seat by pushing on the toilet roll holder, right? You have the toilet paper holder. A lot of folks fall guilty. They'll push on that toilet paper holder as they're trying to get up, and that's not the design. It breaks and you fall. Bedroom. Bedrooms. What can you do to prevent falls in your bedroom? Lights. Night lights. How many of you use night lights? I do. I do. Perfect. And you want to make sure your path is clear, right? Every night before you go to bed, you want to make sure you have a clear path, you have nothing in your way, all right? You have medications. We've talked about that. And if you have some things that really need to be addressed, installing grab bars, I would not suggest using the suction cup grab bars. They're okay if you're just relying on them every so often, not heavily, but it's much, much better, much more secure to get installed grab bars, okay? Another thing, if you find yourself in the shower washing your hair, obviously closing your eyes. Funny story, years ago I had a man tell me, he was telling me how he struggled to keep his balance in the shower as he washed his hair. And he said, you know, finally I just started trying to keep my eyes open when I washed my hair, and I asked him, how's that working out for you? He goes, not good. You know, get a shower seat. Don't be afraid to make these decisions. Get a shower seat, because I'm going to tell you, I have worked with people who have fallen in the shower, and now they have a broken femur. They shattered their kneecap, broke their femur, had a rod installed. The rod this procedure didn't go well. The rod fell through the knee after 3 months, 4 months after the surgery. Right. They had to go back in and redo it. And now there's all kinds of things going on, right? So we want to make sure that we're conscious in the shower, right? This individual is doing very well now. And she works her tail off, though, all right? She works her tail off. So there are some more fall prevention tips in here, more things that you can look at to fall-proof your home. I would suggest you go to the mybalanceuniversity.com. There's a checklist there that you can download. Again, remember, checklists are great. Put them to use, okay? Let's get to work.